Hey everybody, I'm Dr. Michelle May, the founder of Am I Hungry Mindful Eating Programs and Training. And today I have with me Jennifer. Jennifer is one of our newer licensees, and she just had so many incredible things to say about what she got out of the training. And so I really wanted to have her share her story. So welcome, Jennifer. So glad you're with us.
Thank you. Hi guys, my name is Jennifer Hnat. I am a plant-based registered dietitian nutritionist. I have a private practice in Atlanta called Nutrition Atlanta, and have been incorporating the mindful eating skills that I learned during the Am I Hungry facilitator training program in my private practice, and it has completely changed the trajectory of my business.
I just absolutely love hearing that. So Jennifer, you and I first met. I hosted a small weekend intensive here in Phoenix. And
Yes,
you
it
showed
was
up.
intensive.
Yeah, it was intensive, right? It was, we started on a Friday night, ended on a Sunday, and we crammed a lot of information and a lot of
Amazing.
inspiration. Yes, it was really awesome. And that's where we first got to talk. And I could sense that although you had been working with mindful eating for a while, I could sense that there was some pieces that were new to you. Talk a little bit about that experience first.
I learned a little bit about mindful eating and intuitive eating during my dietetic internship in the hospital in a clinical setting, but it just didn't quite resonate 100% with me because in my head I was thinking, oh, I already have this piece down. Oh, I already eat very healthy. I didn't feel like I needed to explore it. And so the honest to goodness truth was I just wasn't open to it yet because I thought, hey, I'm good. You know, I don't need to learn this yet.
It's so funny you say that because sometimes when I'm doing a retreat or a training or a presentation, we call that the I already know that phenomenon, right? I already know that. Because when the brain thinks it already understands or knows something, it shuts down and it can't actually learn. So I really admire people who can be open and more vulnerable and kind of explore things that maybe aren't as familiar. So that probably brings us to how you ended up coming to this retreat.
Right. It kept showing up in my life, like the mindful piece, the mindful piece, the mindful piece. And I even had, studied, used to go to a Buddhist temple. And so I'm familiar with mindfulness, but I just wasn't practicing it when it came to food and eating and my relationship with food. And so I think part of it was because a little bit I was in denial that I needed it, right? Or it's just, I think, what is the phrase, when the student is ready, the teacher appears.
Exactly.
And so I think that's exactly what happened. It was just the divine timing. And I had been looking at your program for a year. And for whatever reason, it just wasn't the right time. And then it was. And then when it is time, things happen very quickly. Like I just said, wow, like it's in, 4 or 5 weeks. Like I just felt a calling to really start practice or start learning about it and really being open to it. So yeah,
That's cool. So you came from Atlanta to Phoenix. Now, again, just for clarity, so this wasn't our licensee training. All of our training, well, most of our training is online. This was actually an immersive retreat. So Jennifer, do you think you came to the retreat for personal or for professional development, or both, as people often do?
Right. Well, I think initially I was looking for it professionally to incorporate the mindful eating skills with clients in my private practice. And what happened then was I really started to explore the concept of mindful eating. I mean, I already had, but I really did a deep dive with it with your program. And it has just been such an incredible journey, like really eye-opening, blew my mind on so many levels, and has helped me understand clients who really, really struggle. In fact, a lot of them ask me if I'm a psychologist because I do understand the mental thought process around food so much more now when you explore the mindful eating piece. And
Mhm.
so it's a great tool to help, connect with your clients. But initially, yes, I did want to come to your retreat for the professional aspect, but I did a deep dive personally and have gleaned so much more from it. Connecting with people on another level when it comes to food and their eating habits. And I think the most important piece is the non-judgment. Like really just being curious about it and letting go of any judgment about yourself or like your past diet habits, because they are what they are and you can change them, and so it's really empowering.
Yeah,
It's
I think that so many of us are steeped in diet culture, and so we hardly even recognize the diety kinds of thoughts that we have. I mean, I come across that all the time, both with professionals and with individuals doing the program. I think you had shared with me before that you thought you were using mindful eating with your clients, but a lot of what you were teaching was more restrictive or diety in nature. Would you talk just about that for a minute? Because I think a lot of health professionals don't really understand sometimes how very different it is to take a mindfulness lens to this.
I started kind of dabbling with the mindful piece with clients and teaching them to, slow down with eating or um, actually what it was more diet rules. And I didn't realize that it was like chewing your food 30 times or, focusing on your portion sizes or making sure you're drinking enough fluids during the day. How does that impact your eating? And it's really easy when you're teaching those types of skills for it to fall into diet behaviors again. Like, am I doing it right? Instead of connecting with your body and saying, listening to that intuitive wisdom of, hey, I'm thirsty, hey, I'm hungry, hey, I'm full, hey, I'm whatever, right? It's so easy to turn those suggestions, even from a dietitian who means well, it's really easy for it to turn into a diet. And I didn't see that at the time. Again, it's just diet behaviors. Instead of listening to how you want to eat or how your body wants to eat, you're following some kind of prescription, some kind of nutrition prescription. And so, I really wish if I could do like a rewind, this would have been the mindful eating piece would have been a imperative part of any nutrition and dietetic program. I mean, it almost seems like obvious now to me, now that I've done this personally and professionally and see the shifts. I mean, the profound shifts that take place with my clients now that I'm incorporating the mindfulness into it. I mean, it's just amazing because clients are able to make the changes on their time instead of them feeling overwhelmed or that I'm expecting them to change. I actually had a client recently who I see weekly, and she was considering bariatric surgery, but she doesn't want to now. But she told me she's been through umpteen therapists, and she's like, I can't believe how patient you are. She goes, I've never stayed with any therapist this long. Because it's all about the non-judgment piece, the compassion, the being curious, the exploring, the ability to just like self-monitor or just check in with yourself and like let your body guide you as far as like how to eat. And even when clients think, oh, I messed up, it's like, no, it's perfect. It's exactly what you're supposed to do. You're always where you're supposed to be in this process, as long as, like you say, you don't lose the lesson, right? Like,
Right.
what can you extract from this situation to help learn a little bit more about yourself? So it is just, again, I wish I had, would have, could have done it sooner, but I'm just really excited to incorporate this into my practice now and my personal life, because it has just shifted so many things in a direction that I didn't even think was possible.
So talk for just a minute then about the personal shifts you've made, not just in your practice, because I think that's one of the things that people are often so surprised about when they do our mindful eating training is how it affects them, it affects their own relationship with food.
Tremendously. Yes. Great question again. Wow. I don't even know where to begin with that, because I think a lot of dietitians are attracted to become a dietitian because healers heal thyself, right? And I did see a lot of other students in my program who, either were following the latest, and greatest trendy diets, or, I myself had tried a handful of diets, and the changes that take place are, it's almost like a series of events, where you're hyper aware of what's going on with you and your relationship with food and just your sensations and your feelings. And it's almost like it gets easy, and then it gets hard, and then it gets easier. But it I don't even know if I can like just sum it up with one word, other than I think it's a very individual and personal experience. I think it takes time, especially I was stuck in diet culture for over 2 decades. So I'm still unpacking and unraveling a lot of behaviors, beliefs. I mean, there are times when I'm in an appointment with a client and I just like, bleh, like diet culture comes spewing out, and I'm like, no, that's
Undo.
I'm like backpedaling. I'm like, backspace, delete that sentence. This is how we reframe this. So it's been a lot of reframing personally. And just, actually I kind of make fun of myself when I hear like that diet culture. And it's really interesting because as soon as I started really, really doing the deep dive into the mindful piece, I'm with a lot of women in wellness groups, and I do a lot of, I work with a lot of female clients. And even on a personal level, when I'm in those groups, I mean, I've never been anywhere where diet isn't brought up.
So
And it's so hard because I just have to sit there and let them talk about whatever, who's doing what. And I'm just like, wow, it is so pervasive. It is just ingrained in our culture. And it's almost, I hate to say this, but it almost feels like normal conversation for people. Like, what diet are you doing? Oh, I'm doing this. Yeah, exactly. And so it's just really shocking. It's been a huge eye opener. And so I just kind of like listen to what's going on. And if someone asks me, then I bring it up. But I find that there can be a lot of like judgment around the word mindfulness. And I had it personally myself, right? Because it has absolutely become more accepted, kind of like yoga and meditation, where like a long time ago, those were taboo words. And I feel like mindfulness is definitely becoming more embraced, thankfully. I tell my clients all the time, if I could do, change 2 things, it would have been to start meditating sooner and start practicing mindfulness sooner, because they just really, really shift your relationship, not only with food, but with your relationships with people, with the way you go about in the world. And so,
Well, thank you for bringing that up, because I do think that again, we could probably title this conversation "The Myths About Mindful Eating," in nutrition or dietetics, because
right.
there are so many myths. And so let's you've brought up a few already that I want to just touch on. So one thing is, early on you talked about having some experience with Buddhism yourself, and so I want to be clear that mindfulness certainly was introduced in Buddhism, but we are not practicing Buddhism as
right,
eating, right?
Right.
Yep, that's really important to understand. It's a great introduction for those for whom that is a connection for them, but this is by no means just.
It's not a religion. No.
Absolutely.
Or a belief system or anything. No.
Exactly. It's simply awareness of the present moment without judgment, which I agree with you, that is a huge key, and cultivating our awareness, our curiosity, our self-compassion, and therefore moving away from these rigid rules to a more present moment, flexible approach to making decisions, not just about eating, but about everything.
So it was really interesting. Just recently, I had a craving for frosting. And because I've been doing the mindful eating piece, I was able to connect the dots between like an emotion or a trigger with this craving specifically for frosting, because that's not something that I crave every day. And it's not something that my body craves. So I was able to say, this there's something that's been emotionally triggered. And in the past, I would have said, no, 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 don't eat frosting. This isn't healthy. This isn't part of the, diet, whatever. And so I was able to sit in a space of exploring the thought the craving. And I was like, this is interesting. Okay, well, let's go get whatever it is that you feel like you need in this moment. And was able to actually eat it and enjoy it without guilt. And have like this huge amount of compassion for myself. Like it felt nurturing instead of punishing.
Shameful, yeah.
Shameful, right? It didn't feel shameful to eat it. It was actually enjoyable. And I was like, this is delicious. And then I was like, I've had enough. Like in the past, because that had been a taboo food, I would have overeaten it, then gone in this really negative cycle of like, oh, I'm so bad, I'm a failure, blah, 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 fill in the blanks with all the negative self-talk. And this time it was just more like, that was delicious and life moves on.
Exactly.
Which was revolutionary.
Exactly. And I think that's one thing that people have a really hard time with. And again, let's stick with the myths theme. A lot of people think that mindful eating is all about tasting and savoring food, which is certainly one aspect of it. But, this idea that you could actually be curious about why you crave something and then go ahead and choose it anyway if you want to, and then enjoy it and then be done with it without feeling guilt and triggering that eat, repent, repeat cycle. It's revolutionary.
Right. I mean, in the past, I would have eaten it, felt guilty, gone to the gym to burn it off. And this time it was just like, okay, like you just move on with your life. So, it was like this completely different paradigm shift with eating, with your, guilty foods, or your just the foods that are on the off list, or your cheat foods, or whatever, all of that diet culture that can just be so deeply stewed in your consciousness. So it was really interesting to just to observe that personally, and to move through it and be like, no big deal.
So Jennifer, in kind of keeping with this theme of myths, so one of the myths about mindful eating is that it's actually about being mindful of what you put in your body. And I think sometimes when I see out there in social media or regular media, when they talk about mindful eating, they're really actually promoting a very restrictive approach to eating. And of course, as you know, that's not at all what we do here at Am I Hungry? We are an absolutely all foods fit approach. But earlier you said that you're a plant-based dietitian. So I'm curious about how those fit together.
Right. Great question. So even though I say I'm plant-based, it doesn't mean I'm plant exclusive or vegan or vegetarian. What I mean by plant-based is that I just like to, because I know what plants can do from a health perspective in the body, I like to help clients educate their palate to see whether or not they like plants, and then they can make the decision whether or not, based on how those foods make them feel, whether or not they want to incorporate them into their lifestyle. So
I see. So it's not really a prescriptive approach. It's more about experimentation and awareness and curiosity. Same principles we were talking about.
Right. And what happens 9 times out of 10 is that clients themselves say, I feel better when I eat this. And I'm like, well, then eat more of that based on, I teach them how to eat based on how they want to feel.
Yes.
The end result. And so then I don't have to tell them what to eat, because I have a lot of clients that, say, well, if you'll just give me a diet plan that I can follow. And I'm like, oh, that is the worst. That is like, it burns my ears to hear that. I want
Mhm.
you to learn how to eat based on what your body wants, based on what your tongue likes, based on what you're like, like what you like to eat. I don't want this to be a diet at all. Like I
Yeah, it
really
has
hate
to be a
making diet plans.
sustainable approach. And I think the other thing that you mentioned earlier that's really important is that you're really approaching the psychology of this decision-making process. And I think that's really important. I think it's also important that many patients and clients need to heal their relationship with food before we can even touch on nutrition in terms of how to
Like,
really, feel better.
if they come to me for weight loss, we have to have that discussion of, let's let your body find its natural, healthy, happy weight, whatever that is. Make that, not the number one driving force behind why you're doing what you're doing. Let
Mhm,
that be, just put that on the back burner, and let's
mhm.
just, reframe your relationship with food so that you can get to the point where you can eat all the foods, whatever makes you feel healthy, whatever in the past was forbidden. Like you can go to your mom's house for Thanksgiving and eat the pumpkin pie with, or whatever. I hear clients say, "Oh, I love my mom's bourbon pecan pie, but it's not healthy." And I'm like, what does that mean? And
Mhm.
so I think it's really easy to get into like restrictive behaviors when it comes to food, just because the talk is out there. It's everybody, this time of year can get really, there's a lot of noise out there, right? It's
Yeah,
crazy.
exactly. Well, and I have to agree with you completely. I think that we sometimes overvalue the effects that nutrition can have on our health and forget the effects that stress and restriction and cycling and
Lack
this
of
weight
sleep.
cycling and all of this lack of sleep, self-care, emotional health and well-being. I think that there's a lot of pieces that really contribute to one's health, and I think sometimes people have this idea that if I just eat this or if I don't eat that, then I'll have perfect health. Whether you have diabetes or a family history of heart disease or whatever, I think that there are some real shift in thinking that needs to take place around I'm going to learn to eat in a way that I can do for the rest of my life, because these
Right.
concerns don't go away temporarily, and we all know that diets are temporary. By definition, they're temporary.
Exactly. So, and that's the other thing that I love is the sustainable approach with mindfulness, is that,
Mhm.
well, the other bonus is that you enjoy your food on a level that you never thought was that you could get to, right? I mean, like I know my favorite foods now. I've been exploring textures and temperature and combinations of food, and I know, even my husband sometimes is like, you've really become kind of foodie about this. And I'm like, it's because I get to eat what I enjoy eating. And so when it's time to nourish my body, I want to nourish it with like foods that I really enjoy, instead of feeling like it has to be some kind of diet food, whether it's, plant-based or frozen or whatever that looks like in your world when you think of diet food. Because, like a lot of people think rabbit food, like a salad would be considered diet food. Other people think like a frozen, like low cal meal is diet food. So whatever that looks like, it just, you don't have to eat those foods if they don't agree with you,
Mhm.
or like your taste buds, or even if you're not attracted to it. Because sometimes when, I'll introduce the concept of like plants to a client, if they don't want it, then I'm like, you don't have to have it. Like, let's just explore foods that feel good in your body. And for some
Right.
people, some people with, IBS, raw plants don't feel good in their body.
Mhm.
So, there's definitely, it's just a matter of them exploring the foods that they want to eat instead
Mhm.
of me telling them what to eat.
So let's also touch then on the bariatric surgery piece, because I know that was an area that you were working in. Are you still working in that field?
I don't work in it from a clinical perspective, but I do see patients pre and post op. I do have some doctors that refer their patients to me.
Okay. So that's another tricky area. I mean,
Oh,
Am I Hungry is a weight neutral program. And so obviously by definition, at least the majority of people that are considering bariatric surgery are doing it to change their weight. So how do you address that, or how do you feel about that?
it is, well, I'll tell you, when I worked in bariatric surgery, the most uncomfortable thing I had to do is weigh people. I mean, it is just such a personal thing, and it can be a shaming thing.
Mhm.
And it dictates people's day. Like I would have clients that'd be like, either they were joyful because they lost weight, or they were like ready to throw in the towel because they hadn't lost any weight. And it was
Mhm.
kind of like the whole system of it's just the system that kind of sets it up for that situation. It's really it's a case by case situation with a lot of finessing, because people are coming to you for weight loss and they don't necessarily want to hear like, hey, put weight loss on the back burner,
Right,
especially
right.
if their joints are achy, or if their weight is causing their issue, or if they think it's causing their issue, then that can be kind of difficult. Um, I had a client recently who I was working on, like, hey, let's just work on this mindful eating piece, and she still came to the decision that she needed to have bariatric surgery. And I was like, well, at least we're working on this mindfulness cultivating mindful eating skills, so that you'll be more successful before and after surgery versus someone who won't. But
Mhm.
that was like a good 4-month kind of fight on my part for her not to have surgery. Not fight in a way of like I was fighting with her, but like me as a clinician, I was trying to educate her on having a healthy relationship with food. And I think just in the back of her mind the whole time, she just has been, thinking that surgery is going to be the best option for her. And that's her journey. And so I'll support her, as best I can with that.
Yeah,
But
it's so
sometimes
tricky.
it is, it's
Yeah,
really
it's
tricky.
really tricky. I struggle with this issue because, obviously we don't promote bariatric surgery, but there are so many people who are considering it or who have already made that choice and are now struggling because it really doesn't fix those underlying drivers for eating. And I think, that's a piece that most people don't get, and again,
Right.
it's a product of diet culture, but it's also a product of fat phobia. This whole idea that if we can just change your weight, everything will be better. Your life will
Right.
be better. You'll be happier. You'll be healthier. And that's not really true. I mean, that's
Yeah.
not
I
really.
love the health at every size movement. I think
Mhm.
that's, we all have different body sizes and body types, and I think it's beautiful to celebrate that.
So I think that's kind of become another myth, is that if you eat mindfully, you'll lose weight. And I really just want to move away from that whole concept, because we don't know what is going to happen with your body. And,
Right.
bodies are all different sizes and shapes. There's no one body size that we should all be striving for. And who knows what will happen with mindful eating. I mean, for some people, their relationship with food has been so restrained and so restricted that actually mindful eating might guide them to feed their body more consistently and joyfully. They might actually see some weight gain. And that's hard for people to hear. But again, if we didn't have such a fat phobic culture, that wouldn't be the worst thing that could happen. I mean, you could
Right.
really have a joyful, healthy relationship with food. That
Right.
could be the best thing that could happen to you.
Right. Right. To not have to obsess and take up so much mental space and time and energy thinking about food all the time. It's like you think about it when you're hungry and not when you're not hungry. But a lot
Yeah.
of times when you're in diet culture, um, you think about food all the time. And,
Right.
and I see this in social media, like,
Mm.
and I can always tell when people are on a diet because they're like, already plotting out their next meal
Yeah.
after they just ate. Like they
Right.
weren't, because they weren't satisfied with what they ate.
I was just going to say, I love the way you put it, how it just takes up so much headspace.
It
What could,
does. It's
what
hurt.
could
It
you be
hurts.
using? Yeah, yeah. What could you be using that headspace on if you
Yes,
weren't thinking
yes, you could be.
about diet and losing weight, or even in some cases, it's not even about weight loss. And I think you and I've used the word diet over and over again, but I think really nowadays, everybody, even dietitians, recognize that diet, other than the true meaning of the word, which is just a pattern of eating, that's
Right,
become sort of passe. We know they don't work. So instead, what's creeped in is healthy lifestyle, healthy eating, things that sound like they're not a diet, but you've really made a great point about how easy it is for that diet culture and restrictive eating to become part of your language without you even realizing it.
right. Yeah, absolutely. And especially when you see it so much, right? I mean, or because I have a lot of clients who yeah, it's just kind of steeped everywhere. I could go down a deep rabbit hole with that, but
No. Well, and I'm sure you do with your clients.
I do.
I'm sure it's a lot of the work that you're doing now. So I'm really really thrilled to have this conversation with you, and really in less than a year to watch the transformation that has occurred with you, because it's not at all unusual for me to talk to people who think they get it and they don't, and it's really awkward for me to say, well, kind of, but that's awkward. So I guess I want to hear it from you. What would you say to, let's focus on dietitian, since you're a dietitian. What would you say
Yes.
to a dietitian who is thinking about it but not quite sure, doesn't really get why it would help, and what difference it would make? What would you say?
Right. I would tell them that if they want to work with people and help them cultivate a healthier relationship with food, it's imperative for them to have a healthy relationship with food. And sometimes I myself was guilty of this as well. I thought that I had a healthy relationship with food. But then when I started listening to my language or my thoughts, or even just like how I would eat, you know, you just have to explore it. I mean, I really wish there was a mindful eating class that dietitians had to take in college.
You know
Or
what kills me about that is we have a mindful eating class for college students. We've developed one,
oh, that's
but
awesome.
yeah, it's all packaged together. It's got the curriculum, it's got the reading material, there's homework assignments with it. It's
Oh, of
all
course,
packaged
yes.
together. So what
Yeah.
we need to do is figure out how to get it into colleges and universities where dietitians are being trained, and any health professional is being
Right.
trained.
Well, the
Mhm.
interesting I have a girlfriend who's a professor at Georgia State, and she knows I've been doing, a lot of this mindful piece, and she had a private practice previous to, going into academia. And she asked me if I would come and speak to her class for a couple lectures on mindful eating. And I was like, absolutely. These dietitians need to start exploring this concept. And so
Mhm.
it's probably going to be a little bit of a grassroots effort, but
Mhm.
without a doubt, dietitians should, whether or not they feel like they have a healthy relationship with food, we still have to study cancer even though we don't have cancer. We still have to study heart disease even though we don't have heart disease. And so dietitians still need to study mindful eating whether or not they feel like they do or they don't, because they're still going to learn something from it
Mhm.
by exploring it. And even if you just gave them a quick semester, or like your program, it's imperative. They have to just be open to this concept because it's food. It's
Right,
food, and you
right.
either have the choice of eating mindfully or mindlessly.
Mm,
So
right.
you
I
might
like what you
start.
said earlier. You said if they are going to be working with people, and you went on to say something else, but I was like, no, you could end there. If you're going to be working with people who eat,
Right.
have to understand the missing piece. I think as you know, we use the mindful eating cycle to really help people understand all the complexity of the decision making, or oftentimes the habitual decision making that's going on around food. And so what we're
Right.
trying to do with the mindful eating cycle is make these habitual decisions bring them into awareness so that people can actually notice why, when, what, how much they eat, and where they're investing their energy. So
Right.
it's not this nebulous concept of, oh, taste your food, oh, don't diet or restrict. There are specific skill sets, there are
Yep.
specific strategies, there are specific things that people can learn that will help them personally, but also if they're a health professional, help them work more effectively with their patients and clients.
Right. And because this isn't taught to us, it takes time to integrate. I mean, I know I worked on different pieces of the mindful eating cycle, some longer than others, some came just naturally and intuitively, while others were like, you know, a much deeper dive. And
Yeah.
so I love the fact that you have those resources and tools, because then when I hear the same kind of conversations or questions coming up with clients, then I can say, why don't we try this? And then when they come back to me and they're like, wow, that was easy, it's like, yay.
Yeah.
you
The
know
other thing you said earlier, and this will be another myth that we should address, is you did this beautiful job of describing your own personal journey with this. You said it was easy, and then it was hard, and then it got easy again. And I think that's a really important piece of this, because mindful eating as a concept sounds really simple. This
yes.
idea that we're going to pay attention to hunger and satiety, and that you're going to learn to eat what you love. It sounds simple. And I think that first door opening of, oh, wow, look at how often I'm eating for reasons other than hunger, or wow, I really can pay attention to my body. That's the easy stuff. But once you start peeling back those layers and start to look at all the things that are going on underneath, it gets hard for a little while. And I think that's where people are at risk of giving up, or
Yes.
feeling like they're doing it wrong, or that it doesn't
Right.
work. And good for you for hanging in there and doing the hard work of really healing that relationship with food. And thank you so much for bringing it to the people that you work with. It's really incredible.
Well, like I said, it has completely changed the trajectory of my practice. It is extremely compassionate. I love the fact that it is non judgmental, and clients are not afraid to be extremely vulnerable with me during the appointments, because they know there's not going to be judgment. They know there's no shaming. Um, and that's why they also ask me, like, are you a psychologist? Because I'm like, I've already done the work on myself. I get it. I
Right.
understand. I was steeped in diet culture for 2 decades. So I understand the psychology behind food and eating and dieting, and all of the messages and all the noise that we can hear. I mean, I'm not immune to it. I'm very, very finely tuned to the essence of dieting and our culture, and this obsession with weight. And it's just
Mhm.
like, it's so much mental space, like,
Yeah.
really. It can and I think part of it is, as a dietitian, by default, that's what we're studying. We talk a lot about how to have people lose weight. And so it's just kind of like a reframe of how to look at that, you know?
Hmm. Yeah, yeah,
Yeah.
that's really powerful work. And I think that's another piece of this whole thing, is that, as health professionals, particularly dietitians, you think you're supposed to know this stuff. And and I think it sometimes prevents people from seeking additional training or additional help, because I think there is sort of a professional pride that goes along with that. And to admit that maybe you don't know it, or even worse yet, perhaps to admit that you might have been wrong, and that you might have said some things to clients or done some work that now you regret because you didn't know better, right? We just didn't know what we didn't know.
Yes, I felt that way a lot of times, and especially clients who've been with me during this transition of incorporating the mindful eating skills and all of the tips and tools and um, the whole am I hungry mindful eating cycle. It can be a little bit confusing because they're like, wait, I thought we were focusing on weight loss and diet plans, and now all of a sudden you're telling me that I'm the expert. And so it can be a little bit confusing for clients, and especially when, I'm just thinking of when I was a dietitian in a clinical setting, when you're seeing someone in the hospital for like, 5 minutes, if that, and they, the doctor's like, this patient needs to lose weight. It's really, how do you like launch into the, well, if they would just have some mindful eating skills, and it's kind of it's kind of a hard place to launch into that. But the doctors that I've been speaking to are really, and even the bariatric doctors are really receptive to the mindful eating piece, because they get it, and they even say, ha ha ha, I should probably come see you. And I'm like, that's not funny, you really should.
Good for you. All right, there's a beautiful place to end. It's really been great to talk to you, and I'm just thrilled for the work that you're doing and will do in the future, and to continue this conversation, because I think there's a real need out there, both on a professional and a personal level for people, and
Agree.
just love that you're out there doing this work.
Well, I appreciate you for like being a trailblazer. I mean, if I had connected with you 19, 20 years ago when you started this, I'm excited to see where I am in 19, 20 years from now. I
Well,
mean,
and I'll promise you, Jennifer, you will be in a completely different place, because I'm not doing the same thing I was doing 19 or 20 years ago. I mean, that's the beauty of all of this, is that there's so much growth and learning that takes place when we allow ourselves to be imperfect and to make
right.
mistakes, and
Oh,
to
it's
be,
beautiful.
yeah, and to be learners, not to be experts, but just as you said, to be willing to tell our patients and clients, you are the expert, and I'm just here to guide you to discover that expertise, to learn to listen to it, and to learn to trust it again, because diet culture teaches us we can't be trusted, but we
Right.
can. Yeah.
Oh, I know that's the hard piece for, a lot of people to let go, that, they just don't trust their hunger signals. They don't trust that they can eat what they want. So it's definitely a process, but it is without a doubt one of the most worthy ones that, that clients can go through. And dietitians, it's just, uh, like I can't stress it enough. I mean,
Yeah.
especially if anyone is going to work in a private practice or work with the population, which is hello, most of them.
Right.
So
Right.
it's, yeah,
Right.
it's imperative that they start working with this, get their relationship with food right.